There are other psychological treatment, including interpersonal therapies. So this is for some people who have more, whose mood difficulties arise in the context of interpersonal difficulties in their life. So the first and foremost, a mentally ill person need to engage with your treating team for full treatment and recovery. Engagement is the most important factor that would determine the success for you to come out of mental illness. So it's very important that you follow the advice of your treating team. It's very important that you take your medications regularly as prescribed, or if you are experiencing side effects, not to stop yourself, but rather discuss it with your treating team. At the same time, it's also important to get engaged in other psychological treatments that are offered to you from the team. Along with that, patients can also help in their own recovery by choosing a healthy lifestyle, for example, focusing on the nutritious diet, prioritizing sleep, managing stress through mindfulness and meditation, making social connection, which is so important in terms of linking in with your close family members or friends that you can trust. Also about linking in with other support groups or other voluntary organization for additional support. So the treatment for mood disorder are broadly divided into pharmacological treatment, which means treating with the help of psychotropic medication, as well as psychological treatment, which in other words we call as talking therapies. So we have numerous antidepressant medication. Generally, most of them are well tolerated. We recommend for someone with the first episode of depression to be on the medication for 6 to 9 months after they become well. Sometimes people who have 2 or more episodes of depression, they may need to be on medication for longer term. For the psychological treatment, we have a number of psychotherapies. For example, cognitive behavior therapy, in which the therapist address the patient's negative thoughts and try to help them to have more positive behavior in their life so that it can lead to more positive thinking. There are other psychological treatment, including interpersonal therapies. So this is for some people who have more, whose mood difficulties arise in the context of interpersonal difficulties in their life. Along with that, there are other psychological treatment like psychodynamic therapy. So sometimes it becomes necessary for patients with mood disorder to get inpatient treatment. So this happens most commonly when they are severely depressed. So they are depressed to a point that they have stopped eating or drinking, they have lost huge amount of weight, they are really not interacting with other people, they can't go to work, they can't take part in the usual activities, and in this scenario, sometimes the suicidal thoughts become more intense or more persistent. So if these are the symptoms, which you call as a red flag symptom, then it's important that we advise the patients to get inpatient treatment. More often, patients go for voluntary treatment, and that's fine, they agree to come in, but sometimes their judgment and their capacity is so impaired by the mental illness that they can't make the best decision for their recovery. And in that case, we may need to detain the patient in the hospital under Mental Health Act. When we decide that someone needs to be detained in the hospital because they have a mental disorder, they need to be seen by their general practitioner first. So basically what happened that sometimes their family members, or other time an authorized officer would make a request for that patient to be examined by the general practitioner. The GP examines the patient, and if they feel that they need to be reviewed by the consultant psychiatrist for involuntary admission under Mental Health Act, then they sign the recommendation form. The patient is brought to hospital, and then the patient is reviewed by the consultant psychiatrist within 24 hours. So the criteria for involuntary admission under Mental Health Act is the presence of mental disorder on the premise that the patient are actually a huge risk to themselves or somebody else, or that the patient judgment and capacity is so impaired that they cannot receive the necessary treatment out of hospital, and that treatment can only be administered while they are in the hospital. Mood disorders are one of the reasons that the patient may be detained under Mental Health Act, but they may be detained in other conditions like schizophrenia or other psychotic disorder. So sometimes when the patients are so depressed that they become a risk to themselves or somebody else, in a way that they have these thoughts to harm themselves or to end their lives, along with other symptoms of depression like low mood, persistently tired, feelings of guilt or shame or worthlessness, or blaming themselves excessively, then it becomes important that they are detained under Mental Health Act in the hospital. So essentially the two criteria for detention is, first, they are immediate and serious risk to themselves and somebody else, and secondly, they are not an immediate risk, but their judgment and capacity is so impaired because of the mental disorder that they cannot receive the necessary treatment outside of the hospital. It is important to note that the patients who have some emotional or mood difficulties secondary to personality disorder or because of substance misuse cannot be detained under Mental Health Act. So essentially there has to be a presence of a mental disorder as per Mental Health Act for someone to be detained in the hospital. So we can inform ourselves about mental illness from, first of all, different websites that give authentic information. For example, there are a lot of resources present on the HSE website or say NHS website, along with we have some resources on the College of Psychiatrists of Ireland website. So it's very important that you just get familiarized yourself with the information from authentic sources.